Morning.
Good morning.
Morning.
You sound awful low key there, Corey. Good morning. How are you today?
Doing good, thank you.
Yeah, we finished our 10-day program. We got the blood work and the lab work, finally, the correct ones.
Yeah.
And she's wearing a hat not because she's lost her hair, folks. She's wearing a hat.
Hair day.
It's a bad hair day. So, Corey, you want to tell the folks here how you feel and the results of the treatments and possibly maybe sort of kind of the food is beginning to taste a little bit better to you. Go ahead, Corey, and Willie, go ahead and tell us how you feel on the last few days of your treatment.
My last few days of my treatment has been going really well, and I'm seeing some huge improvements overall in my body. I think currently, with the blood work coming back, everything was great, knowing that I'm cancer free and in a remission state. I love that fact. But one thing that we found out is I'm dealing with a very low grade type of
infection. E. coli.
E. coli.
Yeah,
And,
it's very easy.
Marit is going to help me overcome that with some new treatments. And as far as
the food. She's downloading the book.
Downloading the book, as I was downloading, I found some recipes that I would interest me and maybe even my taste buds.
Now that you're getting them back.
No, yeah.
You were on how much medication? Yeah, I was looking at your reports, and they've had you on medications since day one, which is what, 2011?
2012.
Yeah, 2012. So the fact sometimes what happens on long-term medications, Percocets, Oxycontin, oxycodone, I can't even, fentanyl patches, is you do lose the ability to taste. And you may notice that Corey is vibrant and she can move. Rumor has it that I'm moving the camera for you. Rumor has it that she dances now. And so she's doing phenomenally well. I'm very impressed. So cancer-free, no cancer markers at all. Her blood work looks good. Her white cell count, her CBCs came back absolutely normal. And I'm told that your employer, while you are in the recovery state, is trying to let you work at home.
Yeah, they were doing some brainstorming, and hopefully that might happen and come true for me. And if that would be the case, that would be awesome, so that I can continue to heal thoroughly, so I can be able to go back to work 100%.
And where is it you work?
I work for the Chattanooga Times Free Press.
And they are phenomenal people. They are doing everything to help with Corey's recovery, taking off a lot of the financial burdens.
Yes.
Which is
I've been very blessed with a very good ohana is what I call it, my work ohana family there.
So what have you learned to do for your bladder?
Kegel exercises.
Kegel, right? And so how are you doing with that exercise and retaining your urine?
That's work. I mean, it's work in progress. I think, I'm doing it. Every now and then, though, it'll just release on its own, and I can't wait till I can control that part of my body so that I don't have to be using Depends.
Yeah.
But I think if I can manage that and alleviate the pain, I think I'd be 100%.
So the pain only comes after urination.
After urination, and
the abdominal muscles are weak from the prolapse of the uterus.
I feel that the muscles in my abdomen or my larger intestines are working because I can feel the peristalsis.
Well, pretty soon when we see her, we'll do another little bit in about 6 months. She'll have these, what do they call it, six-pack stomachs? She'll have like little abdominal muscles, like Arnold Schwarzenegger. She's doing well. No more constipation?
No constipation. I think every urination I have a bowel movement, it feels
Good.
like.
That's good. And that's wonderful. Now, this is Willie, her husband. I'm
Hello.
zooming on Willie. How are you doing, Willie?
I'm doing good. I'm doing good.
Oftentimes, caregivers are the ones who suffer the most because they feel a little bit at lost on what they're doing. But he now has a mission. You both have a mission, and I want to thank you for the privilege of starting you off on your new avenue of life. You have a beautiful son, whatever his name, Jordan, no, over there, who doesn't want to talk to me and doesn't want to be filmed. I could Zoom him, but I won't embarrass him. And I want to thank you all and good health and cancer-free.
Yeah.
Absolutely. God bless you, folks. Thank you.
Thank you, Maria.
And aloha. My pleasure. Thank you.